Hey guys, welcome to Rihanna's Lens, where I interact with you about the components in the STEM field and introduce you to fascinating people who passionately inhabit the scientific and technical frontiers of our society. My name is Rihanna Malhotra, and I'm absolutely elated to share this podcast with all of you. On this episode, I'm joined by an amazing guest, Dr. Himali Kapania Ahuja. She's an ophthalmologist and enthralls everyone with her dexterity in cataract and refractive error surgeries. I'm so thrilled to have you as my very first guest on this podcast. Thank you so much for coming on.
Hi, Rihanna. Thank you for having me as a guest. And I think you're doing a really good job. I've heard your podcasts earlier and they are amazing. So, this is the first time I heard the term STEM, which I think now is becoming a new terminology and it is required for the present generation. So, all the best to you and looking forward to hearing your podcast, much more podcasts
Thank you
for
so
sure in the
much.
future. Yeah.
I have a lot of questions in mind about your profession and everything you do. So, before we get into this interview, can you explain what exactly is ophthalmology?
Okay, so ophthalmology is a field of medicine which deals with the structure, function, and the diseases of the eye. Okay, so it includes eye is a very complex structure. It has different parts. So starting from the outermost layer of the eye, that is the eyelids and the adnexa, that is the eyebrows, the skin and the fat around the eyelids. That is the first layer. Then when we come to the eye as a whole, the eye has three different layers from the outer layer to the inner layer. The outermost layer is known as the sclera, then the middle layer is known as the choroid, and the innermost layer is known as the retina. So, based on the three different layers, there are different um, branches in ophthalmology. Also, there are different diseases associated with each layer. So, if we look at the outermost layer, there is, along with the sclera, there is a transparent layer covering the sclera above it, which is the conjunctiva. And in front of the sclera, the anterior one-fifth of the sclera is known as the cornea. It is a transparent layer of the sclera. Okay, so as you have already introduced me, I'm a specialist of the cornea or the refractive diseases and the cataract. So the cataract comes inside. So the first is the lens and the cornea. Then second, you go inside in the middle layer of the eye, that is the choroid. The choroid has most of the blood vessels. So next to the choroid, the anterior part of the choroid forms the uvea and forms the iris. So the color of the eyes, we say some people have blue color eyes, some people have gray colored eyes. That is because of the color of the iris. If the pigments of the iris are more, the person has a brown colored eye. If the pigments in the iris are less, the person has either a gray colored eye or a blue colored eye. The center hole in the iris is known as the pupil. So, depending upon the light conditions where you're going, the pupil increases or decreases in size. Now, behind the iris and the pupil, there is a lens inside the eye. So, even the eye has a lens, that is a human lens. When we are in a younger age group, our lens is transparent. So, because it is transparent, the rays of light from the outside world pass inside, and the rays of light can come and we end up seeing our things clearly. But as we age, the lens starts becoming translucent and then starts becoming opaque. When the lens becomes opaque, the condition is known as cataract. Okay, so it is a normal physiological process with aging. So people feel that some people get cataract, some people don't get cataract. That is not true. It is basically with age, everyone's lens starts to opacify and everyone has this cataract as a disorder, which is basically opacification of the lens. The third layer that we come to is the retinal layer. So the retina is the layer where most of the nerves are there in the eye, and it is the innermost layer of the eye. So all the light that comes, that is focused by our cornea and by the lens, it comes and it goes to the retina, and most of the light goes to a point in the retina known as the fovea, which is a part of a macula. So this area is where there is maximum amount of ganglion cells, maximum amount of photoreceptors. So because of this, when this area, when the retina is normal, we are able to see. If the retina is not normal, again there is problem, then our vision decreases, irrespective if our outer layers are okay or not. One more layer, the one more important structure in the eye that we have is the optic nerve. So signals from the eye carried to the brain with the help of an optic nerve. So the optic nerve is around um, 1.5 disc diameters. The optic nerve is in the form of a disc. It is around 1500 microns. Okay, so that it is around 1.5 disc diameters away from the fovea, which I recently described. Fovea, where we end up when the light strikes there, we end up seeing the objects. So the optic nerve is just 1.5 disc diameters away from the fovea, and this optic nerve carries signals to the brain. Again, if there is any drying up or damaging of the optic nerve, then again the vision is affected. So because we consider eye as a very small structure, but because it has so many different structures in it, so damage or disorder of any of the structure can affect our vision to some extent and to the other. Some of the structures, when we end up seeing them, some of these structures can the diseases in them can be treated. Some of the disorders, they are permanent, they permanently affect the eye, which cannot be treated. So we have to prevent any damage to those structures, like the optic nerve.
All right. Even an eye that's such a small structure, it seems so vast. And
Yes, it is.
I could relate to some of the points that you said because I learned some parts of the eye in IGCSE. So, and what are the most common cases that you tend to see?
So these days, due to the lockdown and more people staying at home and more students having their online classes, the most common cases that we see is a syndrome known as a digital vision syndrome. In digital vision syndrome, basically people who work on an electronic device, be it computer, laptop, mobiles, TV, iPads, if they are working on an electronic device for more than 8 hours in a day, then they end up getting symptoms like headache, eye strain, itching, blurring of vision, sometimes redness, okay, sometimes severe migraine headache also. So all these contribute to a digital vision syndrome. So, how do you prevent a digital vision syndrome? To prevent it, the most important thing is try to decrease your screen time to less than 8 hours. I know it is difficult these days, which with people working from home and online classes and tuitions happening. But if possible, try to take frequent breaks. There is a very important rule that we have, which I describe my patients. That is called the 20-20-20 rule. In 20-20-20 rule, every 20 minutes you need to take a break. That is, you need to look far for at least 20 seconds. So you need to look 20 feet far for at least 20 seconds. So if you look nearby to an electronic device, that causes constriction of the muscles of the eye. When you look far, that causes relaxation of the muscles, and that is why the eye strain decreases. Okay, so try following this 20-20-20 rule. Second thing that you can do is you can have a blue light filter, maybe on your laptop screens, on the mobile screens, or you can, if you don't have a spectacle number, you can wear a zero number blue cut or anti-glare glasses, which will prevent damaging of the eyes from any blue rays that are emitted from these electronic devices. Also, you can do some eye exercises, like there are exercises important for the entire body. Eye exercises are equally important. So try doing at least eye exercises for 5 minutes once or twice a day. Okay, so that is the most common disease. Other diseases that we end up seeing or cases that we end up seeing are conjunctivitis. Some people say that conjunctivitis is also associated with coronavirus because again we are seeing a viral conjunctivitis. um, with April March season, again allergic eye diseases are increasing. People who are allergic to dust, they come with itching in their eyes. In higher age groups, we end up seeing cataracts, which, as I already explained you, is very common. We also end up seeing a lot of refractive error in children, maybe because people are becoming aware to get their eyes checked. So the number of people having glasses has drastically increased.
Yeah, and I completely agree that since technology is advancing slowly, it's important to take breaks since everyone's online now these days because of COVID. And what is the most challenging aspect of your job?
Most challenging aspects. So basically, these days, okay, I should not say it, but because the things are advancing, because the technology has improved further, so the our patients who come to us, they have also become very demanding. So they also want a perfect surgery. The perfect surgery doesn't only mean that we end up removing a cataract. They also want a surgery in which within a day their vision is perfect and also their quality of vision is good. Okay, so we end up, so when we have to do a cataract surgery, the earlier cataract surgeries that were done, they were done manually, and in that we had to put stitches after the surgery. But nowadays, as the technology has advanced, our cataract surgeries are with just a 1 mm or a 2 mm cut, and it is sutureless, so the healing is faster. The patients are get a better vision earlier, and the quality of the lenses that we put inside after removing the natural lens of the eye, the quality has also improved. So that is why the patients, they get a very good quality of vision. Same is true for with refractive surgeries. People who come to us with refractive surgery, I'm mind you, I'm talking only about two diseases because I am a cataract and a refractive surgery specialist. So even with the refractive surgery, the patients who come to us, they expect that within 1 hour post the LASIK surgery, their vision is 100% clear. So again, for that, the machines that we are using are much more advanced to deal with these challenges. And usually patients are happy, but for that we have to do other tests that we were doing earlier, 10 years back, have increased further. So we'll make sure that we are doing a color contrast test, we are doing a pupil size test, we are doing a color vision test, so that even after the surgery, even after a good surgery, their quality of vision is not affected.
But I think it's all worth it at the end of the day because you're everybody's
Yes.
hero. And of course, like gizmos entering our world has quickened our step, even in the medicine field.
Yes.
And what is the most rewarding aspect of your job?
Most rewarding aspects. So, basically, seeing a smile on patients' faces, patients and their relatives' faces when they are able to see, especially people. These days, it is very rare that we get a cataract which is till the last stage. People want to get it done in the mid stages only. But there have been, I can give you an example. Last year, there was a lady. She came with her husband during the month of May when there was a proper lockdown going on, and she had an advanced cataract in both eyes. Her vision was counting fingers combined. So counting finger 1 meter combined from both the eyes, and she was like, I have stopped doing any work. I cannot do anything. And then I operated on her one eye in May. In between, I our clinic was also closed, so I had to actually operate in my friend's clinic. And when we opened her eye patch and she could see, she was so happy. She so I think that was one of the this is one of the instance that I can tell you, this was one of the best instance that I've had in my profession till now. She was really happy to see that she could actually see her husband. She was not able to see her husband, she was not able to do her daily course. And after the surgery, she was so much happier. She could at least self-sufficiently do her routine activities. Same
Wow,
is true
that's,
with, yeah.
yeah, go on, sorry.
No, no problem. So same is true with LASIK patients also. So again, if the number is -2, so they are used to, they have seen the world without glasses. But some people who come to us, their number is like -7, -8. So without their glasses, they are not able to see anything. But the moment we remove their number with the help of LASIK, and again, they are contact lens intolerant, so contact lenses they don't know how to wear, they cannot wear it, it's not suiting them. So when we remove their number for a -7, -8 or higher number, so they are so happy, they are like, at least we can see nearby their vision is much better than that, but at least without glasses they feel like some burden has gone away from their eyes, from their face, something has gone away from their shoulders. So yeah, that is the best aspect of my career, I would say.
That's really great to hear. And lastly, what advice would you give to any future ophthalmologists out there?
Okay. So first thing, I would want to tell all the people who plan to do MBBS also that it has now become a very challenging field. Earlier, maybe 10 years earlier or 20 years earlier, the competition was much lesser. Now the competition has become cutthroat. And even after doing MBBS, if you plan to do ophthalmology, it has a very steep learning curve. It is not a simple specialty because our surgeries are microsurgeries. So we need to do our surgeries with the help of a microscope. So you need to develop depth perception when you're doing the surgery. So it is a challenging surgery. It has a steep learning curve. And I would suggest all the young ophthalmologists who have just started their ophthalmology career to first practice their surgeries on wet labs, on goat eyes. We do get goat eyes. Practice it on a simulator. There are a lot of simulator machines that are available where you can practice the steps of your cataract and refractive surgeries and then do it on the main patient. You will require a lot of numbers and you'll require a lot of patience to go ahead with the surgeries, but in the end, it is quite rewarding. So, all the best.
Thank you so much, Dr. Himali, for joining me on this podcast. I'm sure the audience enjoyed this discussion as much as I did. The DR in front of your name is not just a prefix, it is your superpower. The video version of this podcast is now available on Rihanna's Lens YouTube. It's also available on many other platforms like Spotify, Google Podcast, Breaker, RadioPublic and PocketCast. Stay tuned for more about STEM fields.